This started in 2007 when there was a need for further supervision of the integrative medicine program. Acupuncture had been offered in the past in many different places, but only one or two centers actually offer it now, and that's because of insurance companies which don't cover this practice. So we may be probably the only center which is offering some of these approaches to patients with HIV.
The correct and treat the origin. It's Zusamli, stomach 36, excellent point. Even though I do it quite superficially, you will feel it, and you feel internal pinch, and sometimes you feel tingling down the stomach meridian, or you feel it.
Yeah.
It's a great point to tonify immune system. It's a great point to assist and T-cell count build up. It helps people to prevent common colds and sicknesses and keeps them healthy and balanced. Feel it? This is a point also of kidney meridian, as I spoke about. The third point is number 16, great for immune function. You can use longer needles if you have some chronic kidney function, but as per your medical report, you don't. So I'm very happy to know that. This is a great point that it actually have been studying in Colombia, and the bracelet, the salt for motion sickness, they're supposed to be pressing for that point. It just, the actual point is deep in between the tendons. That's why I like needles much better. Fast point combination combines points of liver, kidney, and lungs that helps body to detox from toxins that we tend to accumulate in the body due to environment issues, due to medication, the side effects. That's how it helps to eliminate the side effects of medicines. And when people just initiate antiretroviral therapy and they concern about medication, this is the best treatment to offer when it's very gentle and it's very effective. In a combination with body acupuncture, it promotes greater relaxing effect and greater pain relieving effect. Also by the virtue of eliminating toxins from the body. I need to go.
There are a number of different studies about some of the integrative medicine approaches. For example, acupuncture has been studied, and one of the mainstream medical journals published that it really improved quality of life and decreased pain and stress. I have a lot of success stories with antiretroviral therapy. Many patients here who are being followed have come to us in very severe conditions, with very severe medical illness, and with a number of opportunistic diseases, and we have been able to treat that and start them on the highly active antiretroviral treatment, and everybody's doing extremely well. It's very rare to see side effects. For the most part, people are doing extremely well, and they get back to the mainstream of life and continue with their work and schooling and other activities.
Most of my appointments are acupuncture. I do see Dr. Gandhi for, let's see, maybe 3 times a year. I come every 4 months to have my blood drawn. But the acupuncture or the other visits might be, every other week or every 3 weeks, depending on the schedule, whenever they can fit me in. I'll try to come as frequently as possible because I like it. I think I benefit from it, and I think it makes me healthier. With HIV more largely, it's that sometimes, I guess a metaphor might be like a car that is running well until all of a sudden you need to take it into the shop because it's broken down again. And I think people with HIV just wind up having more tune-ups that they need. So they take themselves to the hospital for more visits, and I think acupuncture winds up preventing other things like the colds and the stresses and the flus that would happen, I think, if not for an intervention such as this. Who knows? Who knows if any of these interventions are doing anything? We can only put a certain amount of stock in things like atriplet or pills or antiretrovirals. Even things like acupuncture, there are things that do make me feel better as a patient. But ultimately, the way I'm going to win this struggle is with myself.
Feel better?
Yeah, I always do.
Good luck with the bike, maybe
Thanks.
marathon.
Insurance companies are beginning to recognize that these modalities are valuable, but it's very slow. I think that's the problem. We are hopeful with more people spreading the message of the benefit. This will really change what we're seeing right now. I've seen a number of patients with pain have improvement in the pain. Number of patients with anxiety or depression or stress feel better after getting acupuncture or massage therapy. Tell us about amazing changes in their life and daily living, with decrease in stress and improvement in interpersonal relationships and several other benefits. We have documented all that in our actual patient interactions here. So I see amazing value in these approaches, and I see it in my patients and patients who are being seen at the center, and other doctors also are noting this benefit. It's really amazing to see these kind of results, and that's making me feel that I should keep doing this kind of work.